talk about the Vinita Hospital, where our vision has been to provide world-class healthcare and make it affordable as well as accessible. And we always want to make sure that we are providing global standards and yet delivering it with Indian values. One of the things as we go around and read more and more magazines, we find out that nowadays 1 in 5 people in India are struggling with diabetes and hypertension. The problem is in the state of Tamil Nadu, it's actually 1 in 4 people are struggling with diabetes or hypertension. Equally, what is bad, more than this, is that the stage from pre-diabetes to diabetes, the growth at which that is happening, in India it is happening 3 times faster than the global average. It's much worse that the rate of diabetes in India has become much younger than before. As such, we set out our mission to make sure that we let people celebrate and enjoy their quality of life if they take the right decisions at the right time. When we set up this Vinita Hospital as part of the Vinita Health group, we had a 3-pronged approach. First and foremost, to build a truly world-class hospital which has world-class team, world-class facility, as well as world-class equipment. Equally, while it sounds quite odd, we wanted to make sure that only those people who are required to come to the hospital do actually come. There's lots of other people who can be taken care of closer to their home, and especially in the COVID time, nobody wants to come and visit a hospital. So we wanted to set up a whole bunch of neighborhood clinics, clinics inside corporations, clinics inside apartment complexes, and even in rural areas through our Health at Home. And finally, we wanted to make sure that those people who wanted to enhance their lifestyle were able to take control of their life, would be able to do so by connecting to us digitally. While we were embarking upon this journey, we decided to partner with some of the best in this fields in this country. First and foremost, I'm proud to announce a partnership with VDOC Clinics. It's virtual doctor clinics. And I'll ask my friend Sanjeev Malhotra in a minute, CEO of VDOC Clinics, to talk about it. After Sanjeev, I'd like to introduce Mr. Sujit Chakravarti, who is the CEO of Smit.fit, a brand new app that they have launched, which can not only help you improve your lifestyle choices, as well as provide you continuous glucose monitoring in a very innovative way. We are proud about these partnerships because of cutting-edge technology and the innovations that they bring forth. This partnerships that we are launching today will significantly enhance the pace at which we can offer world-class care and make it affordable and accessible. To reduce the cost at Vinita Hospital, we are also partnering with Niramaya Clinics, Niramaya Pathlabs, who have done hundreds of thousands of these the lab tests, and they bring that expertise directly to us. So without further ado, I'd now like to invite Sanjeev to talk briefly about VDOC and what they do.
With Chennai, we are launching soon in partnership with Vinita Hospital. We have clinics in North India, we have clinics in Bangalore in the corporate setup. And we also have clinical park. This is Arunachal Pradesh association with the medical college over there, where we are providing multiple clinics across Arunachal Pradesh with the remote locations. So at this moment, we have 4 operating clinics and almost 10 in pipeline. And with Vinita Hospital, we'll be setting up a series of clinics across Chennai and surrounding areas.
Started taking over the clinics inside company head offices. They can offer 24/7 doctor availability. Inside apartment complexes, where there is a small room, 500 square feet, where they can connect directly to a doctor. In small neighborhoods also, they have to set up clinics. So to test this in difficult conditions, we also tested it in remote primary healthcare centers in Arunachal Pradesh and other places in Northeast. It works brilliantly. The government likes it, the neighborhoods like it, the apartment people like it. Nobody wants to come to a hospital for first aid. first aid, blood draw, whatever, they can get it done locally in their apartment, in their office. Only in the worst case when there is a requirement, they have to come to the hospital. So that's the purpose. And we're launching today. So hopefully we will have many VDOC clinics across Chennai.
This time.
Very efficient, but as you rightly say, virtual is not the same thing as physical. And nowadays, if you can avoid going to a hospital, it's difficult for me to say don't come to a hospital because I run this hospital. But the right thing for the patient is get clarity at the first place of wherever you work or live. So previously, telemedicine was just a WhatsApp video call. This is not that. We have tested it where we put a patient in another room, put a stethoscope on him, and the doctor can hear it live. So this is for the first time being done in India as evidence-based telemedicine. So there is a nurse there who knows how to do this, and it's multi-speciality. It doesn't have to be only diabetes or something. They take care of that person there. And based on the input from the doctor might say, look, I want you to come in because I would rather do an ultrasound or I have to do a CT scan, then come here. If the patient can be released from there itself, then no need to come here. They can even do it. They also do prescriptions, and all of those prescriptions, all of that discussion is on the Vinita database. So that if the patient ever comes here, it is very clearly aligned to us.
Also, one more thing is once the patient is seen in the hospital and then goes home, the patient may not be in condition to come back to the hospital repeatedly. So that time also it helps the patient to be monitored by the same doctor who had already seen in the hospital and continue the care at home in an evidence-based manner. So you'll be able to do the examination virtually. Like even the study, testing the heart, testing the lungs and all can be done at home. And we also with having one physical interaction, the rest can be continued at home as well.
I am proud to announce 3 partnerships today which help us move along the path to achieve our mission in Kolkata, which is to be a world-class healthcare provider, which is very affordable as well as accessible. And to do that, we are launching 3 partnerships. The first one is with Niramaya Pathlabs to help us reduce the cost of our labs. They are a leading path lab agency based in New Delhi. We are also launching a partnership with VDOC Clinics or several clinics in and around Chennai, which are virtual in nature and are the pioneers in evidence-based telemedicine. And to have a continuous digital connect with our patients, we are launching a partnership with Smit.fit. Sujit is here from Smit.fit. It's an app-based lifestyle solution, digital solution, which can be used for not only monitoring your own health as well as consulting nutrition coaches, health coaches, and if necessary, the hospital. So, translate everything.
Prevention is better than the treatment. So prevention ಮಾಡೋದಕ್ಕಾಗಿ ನಾವು ಮೊದಲಿಂದ ಕಿಡ್ನಿ ಪ್ರಾಬ್ಲಮ್ಸ್ ಪ್ರಿವೆಂಟ್ பண்ணுறது வந்து ಅದಕ್ಕೆ ரீசன்ஸ் டயபெட்டிஸ் ஹைப்பர்டென்ஷன் இதெல்லாமே ப்ரிவென்ட் பண்ணுறது அதே மாதிரி லைஃப் ஸ்டைல் மாடிஃபிகேஷன்ஸ் இந்த ப்ரிவென்ஷன் ನಾವು ரொம்ப ஆக்சசபிள் ஆகும் மீனிங் எல்லாருக்கும் ரீச் ஆகிற இடத்துல இருக்கணும் எல்லாருக்கும் எஃபோர்ட் பண்ணுற மாதிரி இருக்கணும் அண்ட் சிம்பிள் ஆகி ஒரு லைஃப் ஸ்டைல் ரெகுலர் லைஃப் ஸ்டைலில் கொஞ்சம் மாடிஃபை ஒரு ஹெல்தி லைஃப் ஸ்டைல் எப்படி கொண்டு வரணும் அது ஒரு நாள் ஒரு டாக்டரை விசிட் பண்ணி வீட்டுக்கு போய்ட்டு வந்து முடியாது ஸோ தே நீட் டு பி கண்டினியூஸ்லி ஸோ அதை எப்படி பண்ணணும் ஸோ அதற்காக கம் அப் வித் நீங்கள் த்ரீ ஆர்கனைசேஷன்ஸ் வந்து we are joining hands அது one is the lifestyle modification meaning exercise பண்ணுற எப்படி பண்ணணும் எவ்ரி டே மீனிங் ஒரு நாள் டாக்டர் பார்த்துட்டு வீட்டுக்கு போயிட்டாருன்னு இந்த நடுவில் எப்படி அவங்க எக்ஸசைஸ் பண்ணணும் எப்படி ஸ்லீப் பேட்டர்ன் எப்படி ஹெல்தி ஆகிட்டு மாற்றணும் அவங்க டயட் எப்படி பண்ணுறது கொஞ்சம் நல்லா ஆகும் அவரை பற்றி அவருக்கு தெரிஞ்சுக்கிறதுக்காக என்ன பண்ணுறோம் அதுதான் இந்த ஸ்மிட்.fit ஆப் அதே மாதிரி இப்போ அதில் கொஞ்சம் சின்ன சின்ன ப்ராப்ளம்ஸ் இருக்குது சின்ன ப்ராப்ளம் அது டாக்டர் கிட்ட வரணுமா ஹாஸ்பிட்டலுக்கு வந்து டைம் வேஸ்ட் ஆகும் இல்லை ரொம்ப தூரத்துலேருந்து இருக்கிற அவங்க வரதுக்கும் ஆகாது எல்லா டைம் ஸோ அந்த பேஷண்ட்ஸ்க்கு எல்லாமே ஒரு ஜஸ்ட் ஃபோன் கால் பண்ணிடணும் இல்லை ஒரு வீடியோ கால் இல்லாமல் வீடியோ கால் வித் அன் எவிடன்ஸ் பேஸ் மீனிங் என்ன ஆகும் நான் இப்போ பேஷண்ட் கிட்ட வந்துட்டேன் வந்து பேசுகிற மட்டுமே தான் எக்ஸாமினும் பண்ணுவேன் இப்போ வீடியோ கால் அது முடியாது ಡೆಸಿಷನ್ಗೆ ಈಸಿಯಾಗಿ ಬರಬೇಕಾಗಿ ಅದಕ್ಕಾಗಿ ಇನ್ ದ VDOC ರಿಲೇಟೆಡ್ ಥರ್ಡ್ ಬಂದು ಇನ್ ಕೇಸ್ ಅವ್ರಿಗೆ ಹಾಸ್ಪಿಟಲ್ ಬಂದಿದ್ದ ಡೆಫಿನೆಟ್ಲಿ ನಮ್ಮ ಸ್ಪೆಷಲಿಸ್ಟ್ ಮೀನಿಂಗ್ ಕಿಡ್ನಿ ಸ್ಪೆಷಲಿಸ್ಟ್ ಇಲ್ಲ ಡಯಾಬಿಟಾಲಜಿಸ್ಟ್ எல்லாமே எல்லா கಡೆ இருக்க முடியாது. ஸோ வித் லெஸ் நம்பர் ஆஃப் பீப்புள் யூ கேன் மேனேஜ் மோர் பேஷண்ட்ஸ். ரீச் கொஞ்சம் அதிகமாகும், அவருக்கும் கொஞ்சம் வசதியாக இருக்கும். அதற்காக we are trying to do this. Third வந்து நிறைய டைம் டாக்டர் கிட்ட வரும்போது more than the doctor's consultation, it is also the blood test cost. அந்த காஸ்ட் கம்மி பண்ணுறதுக்கே we are trying to work with Niramaya Labs. அவர் ரொம்ப நிறைய இடத்துல பண்ணுறதுனால காஸ்ட் கொஞ்சம் கம்மி பண்ணுறதாகும். ஸோ இன் ஓவரால் ஒரு பேஷண்ட்டுக்கே இந்த எக்ஸ்பீரியன்ஸ் ஒரு லைஃப் டைம் ஜர்னி ಆಗಿರ್ಬೋದು. ಹೆಲ್ತ್ಗಾಗಿ ಅವ್ರ ಬಗ್ಗೆ ಅವರಿಗೆ தெரிஞ்சு ಅವ್ರು இருக்கிற இடத்துலನೇ நல்லா ಅವ್ರ ಲೈಫ್ ಸ್ಟೈಲ್ ಮಾಡಿಫೈ பண்ணுறதுக்கு ஒரு வாய்ப்பு இருக்கும். காஸ்ட் கம்மியாகும் அண்ட் they can lead a normal life. It should be a good journey, beautiful journey. ಅದಕ್ಕಾಗಿ
the mini clinics
we are starting with here ಚೆನ್ನೈல ಮೈಲಾಪುರ ಸೆಂಟರ್ ಸ್ಟಾರ್ಟ್ பண்ணலாம். ಅದಕ್ಕப்புறம் இன்னும் கொஞ்சம் நிறைய சென்டர் ஸ்டார்ட்
சென்னை தவிர வேற ஜஸ்ட் வாக் இன் மாதிரி
VDOC Clinics. It can be walk-in.
சிலருக்கு வந்து பாத்தீங்கன்னா ஸ்பெஷலிஸ்டோட கன்சல்டன்ஸ் தேவைப்படும், அதெல்லாம் நீங்க எப்படி பண்ணுவீங்க?
We will have consultants on the availability on 24 hours.
It based on app அந்த மாதிரி ஏதாவது யூஸ் பண்ணுவீங்க? எந்த டாக்டர்ஸ் எந்த டைமிங்ல அவைலபிள் இருக்காங்கன்றது அதுல
அதுன்னு Vinita Health.
ஓகே, தேங்க்யூ.